Hi, dear viewers. It's always a pleasure to come your way with the online pregnancy school. This is Dr. Linda Vanutu, and this program is sponsored by Promise. It's all about ensuring that mothers who are pregnant go through pregnancy safely whilst they stay healthy and the babies also come out healthy. The program is also sponsored by Vanutu International. We develop human beings to ensure that they come out with their best potentials in life. Samsara Ventures, manufacturers of Bubble Gold liquid soap, are also helping us to bring this to you. Stay tuned and call your friends and family to join you. Over the past few weeks, we have been looking at different aspects of pregnancy, and I've brought to you many things that probably you did not know or you knew and have been confirmed. Today it's a pleasure for me to introduce my guest, and my guest is an obstetrician gynecologist. You have heard this name so many times, so now I know you understand what it means. So Doc, you are most welcome.
Thank you very much.
Can you please tell us a little about yourself?
Well, I am Reverend Dr. Martin Usubuama, obstetrician gynecologist, as you have said, and I am the Greater Accra Regional Hospital.
Right. So the Greater Accra Regional Hospital, a lot of people know as the Rage Hospital. It's one of the biggest hospitals that we have in the Greater Accra region, and they are doing so much. Doc, today we are going to talk about what we call the second trimester of pregnancy. What is the second trimester of pregnancy?
Thank you very much. The pregnancy journey has been divided into three phases.
Okay.
The first trimester, the second trimester, and the third trimester. The first trimester is the first 13 weeks. Then from 14 weeks to 28 weeks, the second trimester.
Okay.
Then from 28 to 40 weeks is the third trimester. So the second trimester generally is a phase which is quite pleasant to most would-be mothers,
Wow.
comparable to the first trimester. The nausea, the vomiting,
No,
the
what is
tiredness,
nausea?
the feeling of the edge of vomiting.
Okay.
And actual vomiting, what most would describe as early morning sickness,
Okay.
the tiredness, and all those fatigue, seems to go down. And so the second trimester is quite enjoyable to most mothers.
Okay.
Indeed, I always say that that is when they gain their appetite, and so formerly you could not eat, but now even if they prepare food and the husbands no home early, they will finish their own, go on and eat their husband's food because they are back on track.
Okay.
It's also a stage that the people begin to recognize that the woman is pregnant. Why?
Yeah.
Because the belly of the abdomen begins to bulge, to grow, and because the baby on the inside, or if you like, the fetus begin to grow rapidly. And so that is simply how the second trimester looks like. And if I could go on, I will add that the fetus at the end of the first trimester is like the size of a lemon, a small lemon. And that's around 13, 14 weeks. Then around 20 weeks, that's around 5 months of pregnancy, it gets to the size of an orange, a big orange.
Wow.
Then at the end, 27 weeks, as a big corn, the big one. And so,
The corn?
yes, the big one.
Wow.
Yeah, so usually at that time, they weigh around 1 kilograms. And the baby begins to demand a lot in terms of nutrients. And so it is not strange that the mother also will have to eat more, and the appetite gets, they regain their appetite.
Wow. Dear viewers, you see, I told you that it's always a pleasure to come your way. Can you imagine that pregnancy that starts very small, you cannot even see with your eye, when the egg is fertilized by the sperm? Now, at the end of the first 13 weeks, the first trimester, the other day we learned that it is not 12 weeks for 3 months, 13 weeks. And I'm sure as we go along, we'll understand why. But at that time, this baby is so tiny. Now the baby has grown to be like the size of a corn. Wow, that's a cup,
Yeah,
right?
the cup, yes.
One piece of corn
Exactly.
with those things on. Can you imagine? And we also learned that even before this time, the heart is already beating. Is that correct?
Exactly.
So what are some of the things that go on as the baby grows inside the mother's womb after this 13 weeks when the baby is within the second trimester of growth?
Right. So some of the things that go on, I mean, let's look at the mother and the fetus.
Okay.
So there are some physiological changes that would that are peculiar to second trimester. Okay. Some of them might have started first trimester already, but they heighten in the second trimester, the pregnancy.
What is physiological?
So physiological changes are the natural mechanisms that the body goes through.
All right.
I mean, just to help the woman go through pregnancy safely. It's an adaptation.
Okay.
The body gets used to it. One of them is, effect on the heart. The heart begins to, pump more blood.
The
mother's heart begins to pump more blood. More blood leaves the mother's heart so as to supply the fetus and all the various organs. And with that, the blood veins or the vessels which the blood will run through, like the pipes they run through, also begin to open up, they dilate.
Okay.
And because blood is warm, as they open up, the mother, temperature, the body's temperature also goes up.
Right.
So they are generally warmer than the first trimester or those who are not pregnant.
Okay.
Then again, the blood volume also increases. So they tend to retain more fluid. So they will put on weight because there's a lot of fluid retention. And that against blood flow to the kidneys also increases. And so the second trimester, there's a lot of changes that go on the second trimester. And key is that because blood flow to the kidney increases, the body is unable to quickly reabsorb or take back the things that is supposed to it's not able to take back all the things that need to be taken back. For example, in the kidneys, there is sugar that needs to be reabsorbed back into the system instead of coming out in the urine. But because of the blood flow increasing, the body is unable to do that completely. So you may have some leakage of sugar or glucose in the urine. You have what we call a trace or 1+. It's not a problem because physiologically, but as we go on, we realize that at a point in time, we need to pay key attention. We don't take some of these things for granted. And so that's what happens in the body. And this will lead to some other changes. For example, there's a physical change, body change. As I said, the woman begins to gain more weight.
The physical means that you can see.
You can see.
Okay.
You can see.
Right.
So the woman begins to gain more weight. She actually realizes that she's getting heavier and heavier compared to the first trimester. Then you have some changes in the skin. The skin begins to become darker, especially the sun-exposed areas like the face.
Okay.
So if you are fair, when you are pregnant, around second trimester, moving onwards, you realize that you look a bit darker. Don't worry.
We should not worry at all.
After pregnancy,
it will
go over. Yes, exactly.
Ah.
Then again, you have some a dark line on your abdomen. We call it linear nigra. It's a dark line that commonly will appear in the first trimester, but heightens or deepens in the second trimester. You may also have some changes. For example, there are some people that may have issues with their gum. The gum becomes big and they become more sensitive in the second trimester and as it advances. And some may even bleed easily.
In the mouth.
In the mouth, exactly. And so, for example, when you are there, we want to advise even you to look at the type of toothbrush you use. But I'm sure we'll get to those areas. Then some may have some nasal bleeds, tiny bleed from the nose. It's not very common, but it does happen from second trimester.
Why does that happen?
It happens because there is a lining in the nasal cavity, the nose, the nostril. We call it mucous membrane. Because of fluid retention, the changes in the physiological event I've said, they become thickened and they easily break. And that can do that.
Wow.
Yes.
Dear listeners, dear viewers, today my guest is Dr. Reverend Martin Buama. Yes, he's an obstetrician gynecologist, and we are talking about the second trimester. He's made us aware that pregnancy is divided into 3 phases. We have the first trimester, which we talked about some time ago. and the second trimester. Then we'll go on to the third trimester, but that will be discussed another time. So today we are in the middle, and personally I believe that pregnancy should be a time of joy and not a time of anxiety. And that is why we bring you these programs, so that you understand what is happening. We have been taking through a lot of changes that occur when the woman is pregnant. I hope that you are taking note. Please, if you have any questions, send me a WhatsApp on 059 242 0625. WhatsApp me on 059 242 0625. Doc, we were talking about the physiological changes, or the changes that are natural that occur within the woman during the second trimester. Please go along.
Right. So the other thing that we also will see, or the women are likely to also complain at that stage, is one of them is some may begin to develop some distension of their veins, distended veins. We call them varicose veins. It's common in the second trimester as they move on. Some may also start seeing stretch marks, unlike the first trimester. So they will see all those ones, all because of the effect of the various hormones working on them. And some may also begin to experience lower abdominal pains or pelvic pains or even back pains. One, because the baby is gaining weight.
Yeah.
Two, because of the release of a certain hormone. It has a big name called relaxin. When it's not too big, relaxin. Relaxin, what that hormone does, that it relaxes the joint in the pelvic area as a baby grows, so that it gets space to fill in, and also as part of preparing the birth canal for the third trimester.
So it's necessary.
It's very necessary. It's physiological, but it can be very painful. Very painful. Yes. Then some may also get leg cramps, which is very common at night when they sleep. You know, they have these pains in their calf or their legs, associated with some tingling sensation and all that. So these are some of the things that happen in the second trimester.
Wow. Doc, are there any things that can be done? You as an obstetrician gynecologist, somebody comes to you in the second trimester with all these things that you have described. What can be done for such a woman?
Right. So generally what can be done depends on what the person is experiencing. And let me quickly add that not every pregnant woman experiences all these.
Yes.
And so it depends on what the person is experiencing. But generally, something like exercise is very important for the weight aspect of it. You don't want to involve yourself in a sedentary lifestyle where you sit at one place for a long time, or you're always in bed. So exercise is very important. Brisk walking, or if you could swim, that is very useful. Things like jogging and those ones are not recommended for pregnant women. And of course, your diet is also very important. Then in hydration, drinking a lot of water, liberal fluid of what intake of water is very useful. It helps in these leg cramps and all those ones. Normally at second trimester, you'll be given some vitamins or prenatal medication that you need to take, supplements. They are very useful, especially the calcium component of them, of it, quite useful to prevent the leg cramps and all that. But there are some of them that when a person develop, for example, gum issues, then probably we may have to get a dentist come in. So generally, good lifestyle, good eating habits, then rest, adequate rest, and all that. There's one thing that I should also mention. That one is dizziness. Sometimes it's dizziness. It's quite common in the first trimester, but there are some who still experience the second trimester. But the hydration is very important, and we also recommend that. When they are lying down, they are getting up, they should not get up straight away. They should actually sit for some time before they stand up, rather than from lying straight to a stand up, because they can feel dizzy. And of course, if you are doing anything, you're feeling dizzy, you need to tone down, get a place to sit. Otherwise, if you force yourself and continue, you are likely to fall or probably collapse. And so, these are some of the things I think we should be looking out and be doing in the second trimester.
Thank you very much. Dear viewers, listeners, this is the Online Pregnancy School. My name is Dr. Linda Vanotu, and my guest for today is Reverend Dr. Martin Buama. He's an obstetrician gynecologist at the Rage Hospital, or the Greater Accra Regional Hospital. We are talking about the second trimester of pregnancy, and we have been told a whole lot of things that we should be aware of. But the good thing is that the doctors are there, the midwives are there. If you have any challenge, you can always go to them. And we have also been given a lot of good tips that if you are pregnant, or your sister is pregnant, your wife is pregnant, you know anybody who is pregnant, I believe that you can jot these things down and share with that person. One of them is that when you are lying down and you want to get up, please don't just get up like that. Take your time, roll to the side, sit down before you finally get up, so that you don't feel dizzy and maybe fall off. That is not good enough. Another thing is that you have to be drinking water. A lot of us don't drink a lot of water. We only wait till we feel thirsty before we drink water. Somebody by the end of the day may not even have taken in 1 liter of water because, hey, I forgot, I didn't drink any water this afternoon. That kind of thing. No, we are told that it's good to have a lot of water. And although this woman may look big and all that, it doesn't stop her from drinking water. Doc, as we go along, what are some of the complications that women or their families should be aware of during the second trimester?
Right, so the second trimester, one should be looking out, and for, of course, the health workers should also be looking out for issues with blood pressure. There's hypertensive disease in pregnancy. One of them is called preeclampsia. All that means that your blood pressure has gone up and your urine has what we call protein in it. It commonly shows up in the second trimester, around 5 months, the 20 weeks onwards. So the second trimester is a period that we need to be looking at for hypertension, and sometimes they may have different presentation with headache, difficulty in seeing visual disturbances, pain in the upper part of the abdomen, and all that. Indeed, if it's picked up early, one will not show.
Upper part of the abdomen?
Your abdomen, your upper, yes, just below your
down the chest.
Down the chest, exactly. Yes. So you may have that pain there. It is not normal, and some may even be vomiting, just like they were in the first trimester, all because of the BP issues. But once these are, it's picked up early, it should not lead to problems. But the danger is that if it is not picked, it's not recognized, then it can be very, very dangerous. It can be very dangerous. And so preeclampsia should be looked out for. Another thing is diabetes. Diabetes. There are people who have diabetes already before they getting pregnant. But pregnancy itself is also diabetogenic. All that it means that if you're pregnant, your chance of getting diabetes is high. And it's high just because of pregnancy. Usually after delivery, for those who diabetes come up in pregnancy, disappear, resolve after the pregnancy. And so one should be looking at for diabetes commonly from 24 weeks to 28 weeks, which falls in the second trimester. One must necessarily be screened for diabetes. Of course, there are some times that we may have to do an earlier screening based on some symptoms. But generally around that time, one should be looking out for. And that is one of the reasons why those who go for pregnant antenatal realize that their urine is checked. They examine their urine. One of the examine the urine for sugar, examine the urine for protein, for hypertension, for preeclampsia I made mention of, and as well as the diabetes. And generally, because there's increased blood volume and the baby or the fetus is getting bigger and putting pressure on the bladder where the urine collects, the storage for urine, pregnant women tend to urinate frequently than when they are not pregnant. And so we could not rely on frequency of urination for us to say that or predict diabetes, as could be done in a non-pregnant woman. And that is why we need to be doing some of these investigations to find it out. Because if it's not found, the effect on the fetus or the baby on the inside in the mother can be very dangerous. So we need to look at for that. Then again, there is a condition called cervical incompetence. All that it means that the cervix is unable to hold the pregnancy, is loose, it's quite weak, and therefore the woman is likely to lose a pregnancy, and that normally occurs in the second trimester, commonly around 5 months. They may present with a painless the contractions, I mean, then the fetus will come out, their water will break, and the baby comes out, usually around 5 months, 6 months, but generally in the second trimester.
Okay.
Unfortunately, this is normally picked up when the incident has happened before, earlier pregnancy. So if one had that one, then going into the next pregnancy, I mean, right in the after completion of the first trimester, the 13 weeks, around 13 weeks, 14 weeks, the mouth of the womb, called the cervix, need to be stitched up, need to be tightened, so that the woman is able to carry the pregnancy far enough. So these are some of the things that happen. Of course, anemia, we know, is something that we cannot go without mentioning it. It's heightened in the second trimester. Why? Because the blood volume, I mean, there's fluid retention, there's water retention, there's what we call hemodilution. All that, it means that the woman's HB, the blood level, tends to drop, which is physiological. And so if the woman is not eating well or taking the supplements, what that means that the blood level or the HB goes down further. And so it's something that we need to watch out. And of course, in our environment or in the areas where there's hookworm infestation, they can also contribute to the anemia in pregnancy. So we need to be watching out for all these. These are quite peculiar to second trimester. It can happen to any other trimester, and so are the other complications, like the bleeding issues. I'll not waste much time here because it traverses from first, second to third trimester. Just that the bleeding in the first, second trimester and the first trimester usually of different causes. Usually if the second trimester you are thinking of a bleeding from what you call a placenta previa. All that means that the placenta, the afterbirth, it's lying in front, ahead of the fetus. And so instead of the fetus being in front, the placenta is in front, and it can cause bleeding. And the placenta can also separate prematurely. Normally, the placenta has to be detached after the woman has given birth. Then the placenta is delivered. But there are some people that for some reasons, for example, their blood pressure has gone up, I mean, their placenta can separate, and the woman will be bleeding. So these are some of the complications that occur in the second trimester that we need to be looking out and we should address them.
Wow. Thank you very much, Doc. This is the Online Pregnancy School. My guest is Dr. Reverend Martin Boama. He's an obstetrician gynecologist. Dear viewers, you know, pregnancy should be a joy. And that is why we have people who have been trained to take care of pregnant women. If you go to the hospital, one of the things you can do for the health worker, the doctor or the midwife, you as a woman, as a pregnant woman, or even if you went with your husband, the two of you can do for us is that give us a good history. If you have been pregnant before, and as he described, your cervix opened prematurely and the baby came out during the second trimester, please tell the doctors when you go. Maybe you have had it twice. Some people come and they've had it several times. But if you do not know that their histories are important and therefore you should tell them, you may not tell them. But as you have heard today, if there's anyone watching us or listening to us and you have had this before, where you become pregnant and within that period, the second trimester, this baby comes out just like that, once, twice, even if it is just once, please, when you go to the hospital, let the midwife be aware, because they will ask you, Doc, isn't it, that how many times have you been pregnant and what happened in the previous pregnancies. So whatever happened, please let them be aware so that they can institute the right measures to help you. What they are doing is that they want you to go through pregnancy successfully. The mother will stay healthy and the baby will also come out healthy, isn't it?
Exactly.
Doc, so for the bleeding, you said it happens throughout the whole period of pregnancy. It can happen.
It can happen.
If a woman is pregnant, because some people say that when they are pregnant, they still see blood. So somebody goes to the hospital and she's told she's 4 months or 5 months pregnant. She's surprised because she has not seen that the bleeding had stopped. So far as she's concerned, she's been having her period, all right. What is the difference?
So once you are pregnant, physiologically you are not supposed to have your menses. And so any form of bleeding while there's pregnancy, it is abnormal, and therefore it is described as one of the forms of miscarriages. So we have what we call a threatened miscarriage. The person will bleed, but the pregnancy is intact.
Okay.
It's only threatened. And so that is what most people, I mean, who say that I was pregnant or I'm pregnant and I've been pregnant for the past so and so months and I've been having my menses or been bleeding. It is abnormality. It is not physiologically correct that you will be pregnant and still be bleeding. It's abnormal. Commonly, it may be a threatened miscarriage. And threatened miscarriage, what it means that with time, I mean, two things could happen. It can resolve and everything continues normally.
All right.
Or it can progress to what you call inevitable miscarriage, an actual miscarriage where everything is come out as complete or some left in as incomplete. And so bleeding in pregnancy, no matter the gestational age or no matter how old the pregnancy is, should not be taken lightly.
Yes.
It is a serious condition that needs to be addressed.
Okay.
And so if you are bleeding, even if it's a spot, you must not take it lightly. You need to, go to the health facility and your health provider, have a check. Commonly may do a scan and a few other investigations to find out, to find out what is happening.
Okay.
By and large, some of them, for example, if it's a placenta previa, and you were spotting, sometimes with bed rest and all that, they tend to resolve, but you are likely to be kept in the hospital because if the bleeding becomes torrential, it will be very difficult for, life-saving measure to be put in place if you are not close to the health facility.
Yeah.
And so some of them will be kept in the hospital, until they deliver, as some will call it, no baby,
no home. But if it's no baby, no home, and this is a precious pregnancy for you, then I believe that it is good, right?
Yes.
And at Rich Hospital, we have very beautiful rooms, so they'll keep you there. But we just pray that, please, do not stay at home. Whatever you see that is not normal, please go to the hospital. Doc, one area that I would like us to re-emphasize is about some of the complications that we take for granted. For example, some women put on weight and they think that this is going to be a boy. Their feet are swollen. They think this is going to be a boy. Some people, they feel dizzy and they think that it's just because of the pregnancy. Please, how can one go through the second trimester safely, knowing some of these things and what she should do? And please add the husbands. What should the husbands be doing to support their wives during the second trimester?
Right. So going to the second trimester safely is important that we, take note of what's possible complication. And as you have rightly said, if your feet is swollen, you have put on necessarily weight. Some even wake up in the morning and their face, it's already swollen or puffy and all that. It is important that it should be addressed, and that can be addressed when we take what we call antenatal care seriously.
Exactly.
So normally you have scheduled appointment. It is important that we honor it, and indeed we expect the husbands also to be part. We know that when there's there's husband support or partner support, the women find it a little bit easier going through the pregnancy journey, knowing that they are not alone. And so the antenatal care is what I will use, or I will stress on that it is a preventive strategy. Yeah. What happens is that when you go there, the various investigations are done, various examinations are done, and these things that are potentially dangerous are picked up much earlier.
Yeah.
For example, this swelling of feet and the dizziness and all you described could be a sign that the person has preeclampsia, the hypertension. It's one of the presentation. And so if you sit home and you will not go to the hospital, what will likely to happen is that the BP keeps going up, then the woman can't fit. The woman can't fit. And when the woman fits, things are the possibility is that the woman can actually go on and die.
Yeah.
And if management is not instituted, and sometimes they may survive, but they have morbidities. They may have complications, even though they are alive. Some may have stroke, and so they went to they were pregnant, and they have come out of pregnancy with stroke, and this is not something anybody would want to wait for herself or wait for the wife. So it is important that we take the signs and the symptoms. All we are saying that if you feel anything which is not anything abnormal, report. And we are talking about headaches. We are talking about the dizziness. We are talking about abdominal pain in your tummy area. We are talking about vomiting, and of course even pain when you are urinating. All these things should be taken seriously. One will have to come to the clinic. One will come to the health facility. And so I would say that the key is the antenatal clinic. Let us go. Will be examined. The right things will be done. The urine will be looked into, and the blood pressure will be checked. And you will do what is called a scan at the various times. And indeed, in the second trimester, one key scan that needs to be done is called the fetal anomaly scan. All the fetal anomaly scan seeks to do is how well the baby has formed.
Okay.
Is there any abnormality during the formation of the baby? That is commonly done around 18 weeks to 22 weeks. Okay. And at that time, all the parts are fully formed, including the sex of the fetus, and therefore you're interested in knowing whether it's going to be a boy or girl. Don't joke with your fetal anomaly scan. Take it seriously, go and let it be done, and inform the sonographer that you wish to know, and if he's able to see, he will tell you. So at the antenatal, apart from all these things, you'll be given the prenatal or supplements, vitamins, because in pregnancy itself, because of physiological changes, the body's requirement for, say, an iron, which is needed to form blood, increases by 2 to 3 fold.
Okay.
And so you need that supplementation. Something like folic acid, it demand increase by 10 to 20 fold.
Okay.
So definitely will give you folic acid and calcium as well. You will be given a tetanus toxoid injection. All that is a tetanus vaccination, as we normally will call it. There is some malaria treatment that's given. What we call it the IPT, intermittent presumptive treatment of malaria. I mean, that is very key because in malaria endemic regions, I mean, the pregnant woman who gets bitten with a mosquito and get malaria sometimes may not have the mother showing signs or symptoms of malaria.
Exactly.
The malaria parasite has desire. It likes the placenta. So it goes there and hides there. So the mother is fine, but the baby or the fetus in there is suffering because the malaria parasite hiding there. So, I mean, we give the treatment at scheduled time to clear out the parasites if there are any, so that the baby grows well. So these things will be done during the antenatal, and then, I mean, once you honor your appointment and do all that, I think you should be very fine with your pregnancy. Wow. And at the end of the day, we expect that you have a bouncy baby with and a healthy mother.
That is what we are looking for, a bouncy baby and a healthy mother. Dear viewers and listeners, my name is Dr. Linda Vanotu, and my guest for today is a Reverend Minister. He's also an obstetrician gynecologist, Dr. Reverend Boama.
Welcome to Greater Accra Regional Hospital, the Antenatal Clinic. I am Reverend Dr. Martin Boama, obstetrician gynecologist here. This is my consulting room. Here I attend to women who are pregnant and of the various trimesters. The first trimester we know is the first 13 weeks. The second trimester begins after 13 weeks to 28 weeks. Then the third trimester is from 28 to 40 weeks. Today I have with me a client who is a second trimester. You know that the second trimester is the most exciting part of the pregnancy. And during the second trimester, the vomiting and the feeling of vomiting and the extreme tiredness and the dizziness that are normally associated with the first trimester is no more for most women. The appetite is resumed and they eat well. In the second trimester again, the abdomen begins to show. So pregnancy cannot be hidden anymore. Now the baby is growing rapidly and beginning to move actively, and so the mother begins to perceive the baby's kick. The second trimester, although very exciting, very interesting, for most women in the same second trimester, we need to watch out for some issues, problems. There are some conditions like high blood pressure and diabetes that normally will show up for the first time in pregnancy during the second trimester. For this reason and other reasons, we pay key attention to the second trimester when a pregnant woman visits us at the antenatal clinic. When they come, we take a short history. That is to say, we find out if they have any issues, they have any complaint, then we'll try and address them. We'll check their blood pressures. We'll check their urine to find out if there is any abnormality in the urine, and that can give us a clue as to what is happening to them. The second trimester is a period that a scan, which is called fetal anomaly scan, is also requested to find out how well the baby has formed. When all these are done, we also will examine them. The examination will look at how well the baby is growing by measuring the size of the abdomen. We also listen to the heartbeat of the baby. So that is what we do for the second trimester. If there is any issues, we address them. So come along with me as I examine my second trimester in the examination room. Thank you. Yo. Mama amida tu akwaba na ho te sen. Eda onyankopon wase. We onyin sen yeto so sen. Mienu wo hu. Yo. Ene anope bibi ewo ho bibi how. Bibi yo. Buye okay. All right. Na undo ni de oguso efa. Umo ya dro no ofa. Yo. O lab test no so ai ni nyina wo hu. Ai o lab ni nyina. Okay. All right. Ya chechere won sa no pay. Si ya chechere won sa o blood pressure, o BP e 116/79 as chance e normal problem bia ni o BP ni mo. Why? And then we 28 weeks on the okay. Yo. All right. All right, into back our show. Show your phone away. Okay. Bruh. Second trimester, the abdomen is obviously bulging. You can see my second trimester client with me. I will first measure the abdomen and see how well the baby is growing. So this is the fundus, that's the uppermost part of the womb, or we call the uterus. Right, so I had 26 centimeters. I'm going to examine the abdomen to see how well the baby is lying. So this baby's head is already down. However, it can change because the baby is still moving all around. Now I will examine for the baby's heartbeat. There you go. That's the baby's heartbeat. You can hear. Boom, 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 boom. So baby is fine. So I will end the examination here and go and write my findings and give my client another appointment. So now come along and let's join Dr. Linda Vanutu as we discuss further or into details the second trimester on the online pregnancy school. Thank you.
You know, Doc, it's good that you're a Reverend Minister,
Right.
and an ONG specialist as well. Because some of the pregnant women don't want to go to the hospital because of some religious reasons. So you being a Reverend Minister and at the same time an ONG specialist, what will you tell us?
So I will say that God does not forbid antenatal or hospital or taking of medication or even surgery. After all, it is He who gave the wisdom.
Yes.
And so God uses diverse ways to heal people.
Yes.
There are situations that He even makes a mad and touch the eyes of someone,
Yes.
telling us that God wanted something to be given.
Yes.
And so, I mean, God told Hezekiah when it was, he had some certain condition. God told her a drug or a herb to be used. And so, God is not against medicine. God is not against surgery. And so, my plea and advice to all, people who would want to stay away from the clinic because of religious reason.
Yeah.
Go back, read your Bible again, and know that the God that you are serving is a God that heals through various means. A surgeon says that I cut, but the healing comes from God.
Amen.
And so, just do what is expected. Sometimes I think that God even feels sad that when He has given you the provision, that this is what you need to take, get well, and you sit there, you fold your arm, and you are praying to God. God does not listen to those prayers. He has answered your prayer by telling them, go and take the water and drink. Go and take the medicine. Go and get this done for you. And once you do that, it's actually obedience to God. If you refuse to do that, it's a disobedience to God. And I think that religion should not keep us away from health facility. Religion, God, with the medicine or the health care facility should actually optimize our outcomes, maternal and fetal outcomes.
Wonderful. It's good that we know this. And I'm sure a lot of people don't even know that a lot of the health professionals actually depend on God for the strength to do this. Because if you are going to do an operation, I believe you pray. You pray that, Father, we are going to do this. We are going to cut somebody open. Let this person survive. Let the surgery be successful. So it is very important. And I ask that because of the preeclampsia that you described, because a lot of the women during that time, unfortunately, do not go to the hospital. They rather depend on probably what somebody has told them and go and lie. Instead of going to the hospital, they go and stay at somewhere else when it becomes very, very difficult. And when they start fitting, that is when they are sent to the hospital. Unfortunately, the baby will be gone, and then if you are not careful, the mother also dies. Dear listeners and viewers, if you have any questions about the second trimester of pregnancy, don't hesitate to send me a WhatsApp message on 059 242 0625. 059 242 0625. Doc, as we come to the end of our discussion, what would you like our viewers and our listeners to take home? What are the key take-home messages for the pregnant women themselves, for anybody who is supporting them, and also for the husbands?
Right. So I will state that pregnancy is not a disease. Pregnancy is natural, it's physiological, and it must be enjoyed. But definitely there are things that we need to watch out on the journey of pregnancy, for it to reach there successfully. One is that your antenatal clinics you should honor them, the appointment, and do the things that you are expected to do. Number two is that you take good care of yourself. I mean, your diet is not just any food. I mean, balanced diet. Exercise, it should be taken seriously. Enough rest and drinking a lot of water. Then also knowing the symptoms of adverse effects, I mean complication, know them. The bleeding, the pain, the dizziness, and the vomiting, all this one should be known. If there's water coming, I mean you should take them seriously. And once you recognize them, please do not delay. Don't say that my schedule is not up. The midwife said I should come 1 month, and so even if I'm bleeding,
that's
I have
very
this
important.
Yes, so you should just go, and I'm sure that with this we should all be fine. The family, and we always will ask for the father or the husband to support. In fact, even in rich, when you come with your your husband, you are seeing earlier.
Hey, that is discrimination.
Discrimination. We want the fathers to support them. So come.
Right. Well, dear viewers, I'm sure you have learned a lot. We have been talking about the second trimester of pregnancy, and we have had a lot of good discussion with Dr. Reverend Boama. He's an obstetrician gynecologist at the Greater Accra Regional Hospital. I hope that if you are pregnant, or your wife is pregnant, or you know someone who is pregnant, you've taken note of what he has just told us. Please, the antenatal is very important. Don't joke with it, and don't say that I went to the hospital yesterday, so today if I'm not feeling well, I'm waiting till my next visit. No, please go as soon as you are not feeling well. Even if it is in the night, just get up and go. There's always somebody working at the hospital. There's always someone on duty, so you will be seen when you go to the hospital. This is the online pregnancy school. My name is Dr. Linda Vanotu, and the program is sponsored by Promise, sponsored by Vanotu International and Samzara Ventures. See you again next week, and I hope that you will share this with your friends. Bye. See you another time. Bye-bye.